everybody. This is Kate Wakelin from Neuroendocrine Cancer Australia, beaming into you and it's Thursday, not Friday. It's the 22nd of October, and I'm coming to you on a Thursday because tomorrow is a public holiday in Melbourne, so I will be not in the office. So I thought I'd take the opportunity to join you on a Thursday instead and catch you all by surprise, and just do a brief little update with you all today. So look, it's really lovely to be with you, and before I go any further, I'd like to acknowledge the land that I'm joining you from, which is the land of the Wurundjeri people and of the Kulin Nation, and would just like to pay my respects to elders past, present and emerging. One of the things that I deeply appreciate about the land that I live on is being very close to the Yarra River, which is called the Birrarung in the Woiwurrung language, and I love going running along that river, and every time I go running I feel so grateful for where I live. I want to share with you, on the weekend I went for a long run with actually one of our neuroendocrine cancer volunteers who's also my running buddy, and we actually saw a platypus on Sunday afternoon in the Birrarung. So so special where we live, and knowing that people will be joining and are joining, are watching from all over Australia and maybe even beyond, from our Facebook private discussion group and also our YouTube channel. So welcome to everybody, and you know, just knowing that wherever you're dialing in from, then it's great to see you. And I can see a couple of people have found the video, so that's really fantastic. So good news, I guess, you know, we often start with a little bit of an update about COVID, and while the rest of the world looks like it's bracing itself for a very big third wave, and we're hearing about lockdown in other countries, we're very relieved to know that in Australia the numbers are continuing to improve, and particularly in Melbourne it's come right down, and we're now starting to be able to travel a little bit more than 5 kilometres from our front door, and exercise for longer and get out and enjoy ourselves in the parklands while the weather's finding up. So I know everybody's been trying really hard with this. I know a lot of people with NETs have been feeling very anxious for a long time. Like, it's been a good 6 months now that we've all been living with this, and that's tiring. It takes a lot of ongoing energy and effort to remain vigilant and remain careful. And I know also lots of people with cancer are very grateful to those around them, who maybe are not vulnerable, especially themselves, but have taken extra special care with their hygiene and being tested and so forth, to reduce the risk on their loved ones and those in the community who we feel are vulnerable. So I know we're all grateful to each other for the efforts that everybody's gone to contain this virus. I've had about 8 friends, so in Melbourne that's been in the thick of it. I've had about 8 friends who have had COVID-19, and I'm very thankful that they have all made a full recovery, but I know not everybody is so lucky with that. So we think also of all of the people and the families affected in much more serious ways. So enough about coronavirus. I didn't set a topic of the day today, which is a bit of a shift, a bit of an unusual twist, and I thought, because it's a Thursday, I wanted actually to give you guys a chance. I know we've had a lot of guest speakers, and I can see Sylvie's joined us. Sylvie actually joined us last week for a really amazing look at what it's like to be a carer and that really unique experience. And you know, so we've actually had a lot of people joining us for these conversations, which I find really fascinating, and I love hearing another person's voice. But I wanted to just check in and see if there were questions from you guys today that you would like me just to quickly answer, and some of them I might need to take on notice and do a bit of homework on, because I don't know everything off the top of my head. But so while I'm giving you a chance to write anything in the comments box, I just thought, well, there was a question that came up yesterday on the phone that I hadn't had before, that might be of interest to some people, and if it's not, then you can fast forward through this bit. So it was on the question of fluid in the tummy, and the technical word for that is called ascites, and that can happen when there is tumour in the liver. It actually can happen for other reasons, but I'm not going to go into those other reasons. But for people with neuroendocrine tumours where there's tumour mass in the liver, that ascites can become a problem. And it results in this belly that's got a lot of fluid in it. And you can actually look like the lady I was talking to yesterday said she felt about 5 months pregnant. You know, it was really uncomfortable to her, for her to sort of sit down. She's having trouble with, she can't get her jeans buttoned up. She's lost a lot of weight, but she can't get her jeans buttoned up. She's having trouble doing up her shoes. She's got a lot of swelling in her tummy and even in her legs. So this is something that can happen. Now with nets in the liver, because they grow usually fairly slowly, the liver's actually quite amazing at accommodating tumours if they come to us slowly. So sometimes we don't see ascites at all, even if people have got a lot of tumour mass in their liver, because their liver's kind of learnt to cope with that and grown new bits of liver around the outside of the tumours and expanded and been amazing. But we can still have this problem of ascites. And the reason that you can get a collection of fluid in your tummy when you've got liver tumours, it's pretty complicated, and I'm not going to attempt to give you a really technical answer for it. But it is because the blood returning from the digestive organs needs to flow up through the top of your tummy, up through the liver. And if there is more pressure in the liver because it's all squashed up with tumour, the blood finds it more difficult to get through, and that results in a whole series of, like a cascade of chemical shifts in the body that mean that the body thinks, oh, I need to retain water, and then the water accumulates, the fluid accumulates in the tummy space. So it's not actually within the bowel. It's not like having a big drink and having lots of liquid in your stomach or inside your gut. It's actually sitting outside the gut in the space between your gut and the muscle, in the peritoneal space. So, and as I said, it's really uncomfortable. There are some things that they can do for this. So sometimes it's some medicines can help, so fluid tablets. Sometimes taking steroids can help reduce the swelling in the liver, and that can allow the fluid to kind of normalize itself again. So that can be done. But sometimes people actually find that we need to do a drain of the fluid in the tummy. And there's a number of ways that can be done. It's done with using a sterile needle essentially. They put in some local anaesthetic and drain some of that liquid off the tummy. I've seen people where there's actually been like several litres of fluid in the tummy, and they just feel so much relief afterwards, after that fluid's been drained. Sometimes the fluid can reaccumulate, and in that situation, sometimes they'll leave like a tube in the tummy sticking out through the skin with a collection bag, just to allow that to sort of flow freely if it's reaccumulating really frequently, and that can just help the person stay comfortable. So just a really, in case you're interested, in case you've heard of ascites or you've seen someone maybe with a lot of liver tumour where their tummy just seems to be really, really bulging out, and you're thinking, well, they don't actually look like they're putting on weight anywhere else, but their tummy's bulging, and that might be what's happening for them. And there's some of the things that we can do about it. The lady I was chatting to yesterday was really worried about what it might be like to have that drained. I've seen it done quite a lot of times, and what I was remembering, and I'll have to tell the person that I had another read about it last night after I finished my calls, and because when I last saw it being drained it was a couple of decades ago, and they weren't using any imaging or anything when they were draining the fluid. They still do that, so sometimes they'll still drain the fluid if it's really obvious where the fluid's collected. They still may drain it without using any imaging, but often they'll use like an ultrasound or a CT scan at the same time as doing that drain, so that they make sure they get the needle right in the collection of fluid. But yeah, it generally is not a horrific procedure. It's different to like, I know that people have liver biopsies, and that can be pretty rough. It's not like a biopsy sort of needle. It's a needle that really just goes into the collection of fluid. So you feel the anesthetic more than anything. And then the relief afterwards of just being able to sit normally and bend over and do your shoelaces up and that sort of thing is usually pretty the thing that you remember. So yeah, so I wonder if that helps with ascites. If I don't know if anyone has ever heard of it before, or whether that was a new one for you as well. It's certainly not something that comes up every day for me, but I thought, oh well, I'll explain that one to you. And I can just see that someone has actually had put a question into the comments box about, and I'll read this one out. So a quick question: since round 1 of lutein oral chemotherapy, little scratches on the arms and legs just don't seem to heal, and can I recommend a good cream to use to help heal it? Oh, that's such a good question. When we are giving people chemotherapy and radiotherapy, we're essentially we're damaging the we do it to damage cancer cells. You know, that's the first thing. Obviously, we wouldn't do it otherwise, but it essentially it kills cancer cells. But we know that with radiation and with lutein therapy, there is a small amount of radiation that's experienced by the other healthy cells in the body, and certainly with chemotherapy, it's very difficult to make just cancer cells and not your regular body cells more fragile or unwell. The cells that are most susceptible to damage from radiation or from chemotherapy are the cells that are rapidly making new ones, because that's what chemotherapy targets. It actually really zones in on the cells that are actively reproducing new ones. But if you think about it, the cells on our body, the healthy cells on our body that are doing that the most are the ones like the inside of our mouths, our bone marrow, which we probably all know about, but also our skin, because we're shedding skin cells. It's sitting as dust bunnies underneath our beds, which is quite a horrifying thought. Maybe I shouldn't have gone there at lunchtime, but our skin is making new skin cells all the time, and so that is really sensitive to chemotherapy and radiation as well. So often people who have had some chemotherapy will find that their skin is more fragile and doesn't heal as well, and so it's I guess unfortunately one of those very normal side effects. It also can be very dry, and sort of flaky and just flimsy. So yeah, look, the question was, is there a good cream to use? Well, the first thing to do is to make sure that any little cuts or scratches in the skin need to be monitored really carefully to make sure they're not getting infected, and actually keeping them very clean, protecting them from the elements when you know your skin's a little bit more vulnerable. So, you know, you might not be a gardening glove kind of person normally, but maybe you need to go there at the moment. You know, when you're doing the dishes, grab some dish gloves, even if you're not a normal dish glove kind of person, just to protect the skin, because once it's got a cut or a scratch, it's going to be a little bit more difficult to heal it up, and also it's more prone to infection, and then an infection might be more prone to getting a bit bigger grip on you because of your immune system maybe not working quite so well. So prevention's always better than cure, so see if you can avoid cutting or scratching yourself. If you do, then you're keeping it very clean, making sure that, you know, if you scratch yourself at the time, giving it a really good wash, and then covering it with usually just a clean dry dressing is also, you know, really important to protect it from any germs that are out there in the environment. In terms of creams, there's a lot of different creams that can be used for like abrasions and that sort of thing. There's one that I used to swear by for, you know, whether it was a nappy rash or a little bit of a graze or whatever. It's called Pseudo Cream, which has got a lot of zinc in it, which is, you know, I don't know if there's any clinical evidence for that one though, and I'm not paid by Pseudo Cream to give them a plug, but that's the one that I keep in the first aid cupboard for if there's something like that going on. But also just keeping the skin well moisturized generally will help, because it will lubricate the skin and mean it's less likely to crack. So I don't know if you've ever tried to smile with very, very dry lips and it's gone boom. So keeping your skin moist and well moisturized will definitely help with preventing little cracks and crevices and things emerging on the skin that are going to be more difficult to heal. So I don't know if that helps. You know, using an antiseptic cream if it's obviously been a contaminated wound, something like Savlon is probably a good idea, or some Dettol when you're washing it, keeping it clean, keeping it covered. If you feel like you need something else on it, then maybe something like Pseudo Cream. And probably the important disclaimer at this point is if you're concerned, then please see your doctor. If this persists, please do. Don't hesitate to check it out with your doctor. It's not such a silly thing to go to a doctor about. So, yeah, I don't know if that helps, but for that person who wrote that question, I am going to tell you a couple of other little bits of news while, just in case anyone else has got a question that they want to type in. But otherwise, today might be a quick one, which is absolutely fine with me because I've got a few things on my list. So I wanted to talk to you about our Facebook Friday broadcasts. We've been doing them for about 6 months now, so we've done quite a number, and we actually did some looking at the stats recently, and it seems that they get a lot of people viewing the videos, which one could assume maybe that's helpful. So, but maybe let me know if you're finding them helpful. What is it in particular that is good for me to be focusing on? Am I doing too much talking about coronavirus? Am I talking not enough about something else? Do you want more guests? Do you want more just Kate telling you what's in her head? Like, please do feel free to give us some feedback, and we might do that in a slightly more structured way at the end of the year, but maybe it's time to get your thinking caps on and let me know if there's something that you'd like more of in these sorts of updates. I wanted to let you know that I've got a few things in the pipeline heading towards the end of the year, and I thought, well, maybe I'll just let you know about some of those so you can kind of have a bit of a taster of what's to come. We're going to have a couple of weeks focus on intimacy and sexuality coming up over the next few weeks. So that's probably not one for little ears, but we know that it's an issue that's really important for people with cancer. There's a lot of changes that happen. I don't need to tell you this. There's a lot of changes that happen in bodies, and there's a lot of changes that happen in relationships and in our heads when cancer's on the scene, and that can have a really huge impact on your ability to be intimate and show your affection with a partner, or even your relationship with yourself, and your self-confidence about your body. So we're going to spend a couple of weeks focusing on that. The first week is going to be I will do that one, and we're going to look at some of those physical changes that happen with the way the body works in terms of sexuality and intimacy with cancer, and also just getting older. I'm going to talk about some of the normal things that happen to us all as we get older that affect that area of our lives, because I don't know, we hear a lot about it in the media, but often it's young, gorgeous things that are maybe we're maybe at a different life stage. So we'll talk about some of those things. I won't be titillating, it's going to be very factual, but that might help. And then we've actually got a guest speaker, Dr. Amanda Horden, who has done extensive research into sexuality and cancer, and she's actually just publishing a book, and she's very kindly agreed to come on in a few weeks' time and do a follow-up session just talking about self-confidence and intimacy, and I guess maybe broadening some of our assumptions about how all of this needs to work or is supposed to work, or some tips and strategies for how to I guess be a little bit more fulfilled in that area of our lives. A couple of other topics that we're going to be focusing in on, so particularly around some guest speakers. We've got Dr. Grace Kong from Peter Mac. So those of you who go to Peter Mac may well know Grace. She's part of the nuclear medicine, the team of nuclear medicine physicians, and she's actually spoken at some of our forums before, and she's actually agreed to join me via Zoom for one of our weeks in a couple of weeks' time, talking about questions about nuclear medicine. So that's in regards to PET scans and PRRT. Now that is, I think, a Pandora's box. We could probably spend 6 weeks consecutively on Fridays talking about it all Friday. Like it's a very big area, but we want to make sure we really look at what your questions are. So maybe that's a thinking cap thing as well. If you've got things that you've always wondered about scans, and I've certainly got questions that people have asked me that I've never really got the answer to, so I'm going to have some up my sleeve as well. But maybe think about your questions about PET scans and about nuclear medicine generally, and PRRT, because we would love to have a really active discussion on that day. A couple of other things that we are going to be focusing on, one on family and friends, and one person in particular who we've got a guest speaker whose husband has NETs, and we were talking a little while ago just about the way that they've they really decided from the very get-go about some of the key decisions about how they were going to communicate with their family and their friends, and some of the things they've learnt along the way. So I'm really looking forward to that one as well. And the other thing that we're going to do very soon is do a little bit more of a closer look at our GP education program, which is very, we're just doing the finishing touches on our GP education program. So that's a series of 4 modules, and I'm not going to tell you anything more about it except to say that we want you all to get your GPs to do it. So we're going to be doing a little bit of a look at what your GPs will be in for if they go ahead and do that training program. I can see there's another question about dizzy spells on Lanreotide or as a symptom of NETs. Oh my goodness, that's such a good question to the person who has written that question in. There's a plethora of reasons why someone might have dizzy spells, and it's, I guess the first thing to say is if you're having dizzy spells, then it's really important for you to talk to your doctor and get a thorough head to toe. The reasons can be anything from really very mild and minor and easy to fix right through to very serious. So we want you to make sure that you talk to your doctor about feeling dizzy. Some things that can cause dizziness are things like dehydration, and if you've got diarrhea, and sometimes people, when they're on Lanreotide, they might have a worsening of diarrhea sometimes as a side effect, and I know I've talked about that in another video. But if you're experiencing diarrhea, that can lead to dehydration, and that can certainly lead to dizzy spells. The other thing that can happen with somatostatin analogues like Lanreotide, or the other one which is Sandostatin LAR, is you can get fluctuations in your blood glucose level, especially for people who are already diabetic, but sometimes people who might have been borderline diabetic and then they've developed diabetes through their process of NETs and NET treatment. Dizziness is a really important symptom to be paying very close attention to. So I'm not going to delve too much into that one today. I do want to do a bit of a deep dive into diabetes and blood sugars in more detail, but I need to do a whole heap more homework on that one, so that's one for another week. But the short story with dizziness is that I really want you to see a doctor, because I can't tell you what's causing your dizziness just by the question. And even if we were talking on the phone, I might ask you a few more questions about it, but really you need to see your doctor about dizziness. It's really important to follow that one up and just make sure that everything's going okay and that we work out what's causing it, and hopefully we can also help you to do something about it. So I wanted to tell you about a few things that are coming up. Someone's just made a comment to say that they think that Grace Kong is really great at explaining things and easy to understand. So that's a fantastic endorsement, and thank you. And I'm so looking forward to having her on. I'm really looking forward to that conversation. So a couple of things that are in the calendar that I wanted to tell you about. I've got the floor, so it's time for Kate to do all of the plugs. We've actually got a few webinars coming up. So I guess the focus over the last few months was getting some topics all in a row for Facebook Fridays and things. But we've been planning some webinars for a while, and we've got dates and registration open for them. So I wanted to make sure you knew about that. The first one is on the 5th of November, and it's on a really rare form of neuroendocrine cancer called Merkel cell carcinoma. A lot of people have never heard of Merkel cell carcinoma, but it is a neuroendocrine cancer, and it grows primarily, it starts on the skin. So even though it's rare, we know that people need to know about this. So we're going to run a webinar. It's going to be recorded, and it'll be on our YouTube channel for perpetuity for those people who come along in the future needing to know about this subject too. We've got a couple of really fabulous guest experts, as well as a patient who has been living with Merkel cell carcinoma. So that we're really looking forward to that on the 5th of November. Then following up hot on the heels of that one, on the 10th of November, it's World NET Cancer Day, and we are celebrating that by doing a massive whip around the country via Zoom and really beaming into all of the major treatment centres and centres of excellence for neuroendocrine cancer around Australia. So we'll start over, actually I'm not sure exactly where we're starting, but we're going to pop in at Fiona Stanley in Perth and talk to Dr. Bill McDonald and David Ransom. We're going to whiz over to the Royal Adelaide and talk to Professor Tim Price and Gabby Chekic. And I'm sitting here telling you the speakers from Perth over, and then thinking, I didn't pull out my flyer with all of the speakers on it, so I'm not sure if I'll remember them all, which is embarrassing. We're coming over to Peter Mac and talking about, I think Grace is talking at that State of the Nation too, so I'll make sure when she's doing her nuclear medicine session that she doesn't give us any spoilers for the State of the Nation webinar. But and I think, and then we'll be also talking with the Royal North Shore crew in Sydney, and then heading up to sunny Queensland and checking in with the doctors up there, Dr. David Wild and Dr. David Patterson, to find out. And we're going to be talking about what research is happening in each state, what the state of play is, what the direction is, the things that they're working on, the things they're excited about in each of those states. So we're really looking forward to that. So that's on the 10th of November, and the registration for both of those webinars is open on our website, so I'll definitely put a link in the notes to that after I finish today. The other thing that the other webinar which we have in the pipeline, which is not open yet but will be very soon, is our NET specialist dietitian from Peter Mac in Melbourne, Dr. Erin Lang. So she has been doing her PhD looking at nutritional deficiencies in neuroendocrine cancers, and she has finished that research and she has finished writing it up, and she is in the final stages of, she's done all the revisions to that document, and it might be in the letterbox getting posted off to the final examiners, as we speak. So I'm hoping that by the time she does this webinar for us, we will be able to indeed call her Dr. Erin Lang, but she will be doing a webinar for us later on in November, talking about her research and what she has found, and that's going to be one for both patients and also health professionals. So if you've got a dietitian or a GP or a doctor or a nurse or someone who you think would be interested in that one or any of the webinars that we're doing, then feel free to pass those details on to them. The lovely thing about Erin is that she has also agreed to come back after that webinar, which will be quite detailed and technical, and she's going to do a Facebook Friday just with our group, where we'll be able to really drill her on well, where does the rubber hit the road, and what does this all mean to all of us, and give you all a chance to really ask your more detailed questions. So I'm very excited that Erin is going to do that webinar and then follow it up with a Facebook Friday with us as well. So I can see there is someone else who has written a question in, so I'm just going to have a little look. Ooh, is there any theory or evidence that prolonged hypertension, which is high blood pressure, can be considered carcinoid crisis? I've just returned from my first luteate at a hospital, which I won't mention, on a fall, and blood pressure very high for half an hour with rest. Oh, I'm not going to mention your name, but that just sounds just awful to have gone through, to have a fall at the train station following luteate therapy. I'm so very sorry to hear that. I think if you've had luteate therapy and you're getting a fluctuation in your blood pressure like that, I think that's needs to be looked at as a potential. Carcinoid crisis is just like a big version of carcinoid syndrome. So we know that blood pressure can be a factor. Blood pressure can go really high, but sometimes it can go really low too. So, we can get those big fluctuations. And sometimes when we give luteate therapy, which is PRRT, we can essentially we're giving radiation to your neuroendocrine tumours, and those tumours may well be hormone producing tumours, and so oh dear, so the radiation can make those tumours really grumpy, and sometimes with some people they will get a flare in their symptoms. Whether we call that carcinoid syndrome, whether it's getting big enough to call it carcinoid crisis, that's a question for your doctors to really assess you on. What I would be saying, and I'm sure that your doctors are already onto this and thinking about this, is that for subsequent doses of luteate or PRRT, they're going to want to monitor you quite carefully. Sometimes when people have a flare in their symptoms, they'll actually do the treatment in hospital. So I've actually got two people this week who are both having luteate therapy, and they've both been admitted to hospital for the therapy, knowing that we want to keep a really, bit more of a close eye on, because they had some severe symptoms with one of those doses. So look, it's not a guarantee that it was linked to your PRRT treatment, but I just think that given that you had just had the PRRT treatment and you had that fall especially, they're going to want to be paying very special attention and care, and the person who has written the question is out of town, so even more when there's travel involved, they're going to want you to be, they want to keep a very close eye on you for your next treatment. So I hope it doesn't happen, and I hope it was just a passing faint, but it may have been associated. If there is a flare in the symptoms, this is really important, is that sometimes they'll give some octreotide, so some short-acting octreotide at the same time as the lutate therapy. They try not to do that because it goes into the same receptors as the PRRT, but if someone's getting this massive flare in their symptoms, then sometimes they need to. So, that's something that they'll keep an eye on. And that's why we want these treatments to be given in the large public hospitals where there are all of the teams and the equipment and the expertise, so they can keep an eye on you. And it's really unusual for this to happen later down the track like this at the train station. So again, I'm just really sorry to hear that happened. That must have been really scary for you and for everyone around you. I guess it's possible that it could be linked, and that it could have been a small version of a carcinoid crisis. So yeah, they're going to want to be careful next time. Just in case there's anyone else wanting to write in, I'm going to finish up in a minute, but the last thing I had on my list to just give you a little bit of an update on is those of you who know me well know that I do like to go for a bit of a run, and every year, really since I started at Neuroendocrine Cancer Australia, or Unicorn as we were back then, I've run in the Melbourne Marathon event, and the first year I did a 10-kilometre run, which I thought I was very clever, but then I've progressed to doing half marathons, and I've done quite a few of those now. This year, of course, with coronavirus, the whole thing got canned, and I sat, actually, do you know, the day that we were supposed to run the marathon, it was really hot in Melbourne. It was like 28 degrees, and I went out for a run with my buddy Catherine, as we do, and I nearly expired just running about 7 kilometres, and I was actually really, really pleased that I wasn't running a half marathon on that day. But it's really sad. It's a big part of the year for me every year, and for me it's a way of telling my family and friends, hey, why don't you donate some money? This is my only time in the year that I ask everyone, in my family and friendship groups, hey, look, why don't you support the work that I do? You should meet my patients. They are divine, and we want to be able to do everything we can for them and get their treatment working better. We want to educate your GPs. We want to make sure that you've got the booklets and the information you need. We want to find a cure for neuroendocrine cancer. Anyway, so every year I do this Melbourne Marathon, and this year it got cancelled, but they are running a virtual event. That means that they're going to send me a bib, and if I run the full 21.1 Ks, I get a medal, which probably get one of my kids to stick around my neck. But I'm going to go ahead and do that, and that's on the weekend of the 5th of December. So it's a few weeks away still to train up for this event, and it might be a bit warm by then, so I'm not going to promise to get a PB or win any records, but I will definitely be doing a half marathon on that weekend. So we've actually set it up as an event, or as a fundraising event on our website, and this is not asking patients, please don't think that you need to donate to this, because I know that you're all living with the impact of neuroendocrine tumours, so that please, this is not the aim. I'm not asking you for money. However, I know that there are some people in our community who extraordinarily are active and do run or do walk or ride their bike, or are still are really active, and we celebrate that, and I think that's really fantastic. And I would love to extend the invitation out to our community to say, if you want to kind of join me in solidarity, walk a kilometre, walk 5 kilometres. I know we had our Steps for Nets, Let's Walk for Nets earlier in the year, and that actually had a lot of people who were really inspired to go for some longer walks and get out there and enjoy the fresh air. So if you're one of those people who found that really helpful and useful, maybe you'd like to work up to a goal of, in a month and a half's time, maybe walking 5 kilometres, which, at a brisk pace is about 1 hour and 20 minutes. I've set up a team on the website, and I would love to have some friends, because at the moment I look like I'm you know, on my own. I don't have any friends. I'd love to have some friends. You don't even have to do it as a fundraiser if you don't want to, but if you would like to join me for a virtual run or walk or bike ride or a swim even, a knitting marathon, I don't know. You know, the sky's the limit. But if you'd like to join me, then I would love to have you there. I will post a link, as long as you take that with the grain of salt, that I'm not asking you to donate money to you know, of course, if you're a millionaire and you'd like to, then you're very welcome to, but this is not a hard word on our patient community to fund us, but just wanted to provide the opportunity for people to join me virtually. And I'd love to be running out there along my beloved Yarra, knowing that maybe I've got a few people from around Australia who are also getting out there and being active on that weekend, to raise some awareness and maybe even raise some funds for Neuroendocrine Cancer Australia. So I'm just going to have one last quick look at someone's asked how you participate. I'll put a link in the notes, so you'll be able to find that link pretty soon. Someone's just also talking about blood pressure. So let me just read that question, because I can't read and talk at the same time. Large fluctuations in pulse rate and blood pressure medications for high blood pressure, which is now under control. Wow, so the pulse of this person is talking about a pulse rate that's fairly high and can last for a few minutes or several hours, and is that related to carcinoid syndrome? So I guess the important thing for us to say is, someone else has just said, can we get unicorn singlets? Oh gosh, can of worms. I'm going to come back to that. I'm focusing on the blood pressure for a second. As we get older, there are other things that can go wrong with our hearts, and there is an arrhythmia or a change in heart rhythm that can happen as you get older, that can happen to quite a lot of people. It's called atrial fibrillation, and that can result in a fast heart rate. Now, I'm not a cardiac nurse, so I don't want to kind of go delving too much into that territory, because I probably will say something wrong. It's been 30 years since I did heart function at university, but it's really important to see your doctor about any kind of perceived fluctuations in your heart rate. It may be related to your neuroendocrine tumours. We can certainly get like a racing heartbeat with some of the hormones that neuroendocrine tumours can produce. The other thing that happens with neuroendocrine tumours for some people is they get that carcinoid heart disease, which we've talked about in the past, which means the heart's having to work extra hard to get the blood to flow around the body, and that can result in things like shortness of breath and actually dizziness, as we were going back to that previous question. So the short answer to anything that's cardiac related, you know that I will always send you back to your doctor, because they make me a little bit nervous, these hearts of ours. We want them to keep ticking, and it's impossible to really know from the information that you've told me whether it's related to your tumours or not. It's possible, not really something that I can say for sure. So yeah, but definitely, regardless, you need to have it checked over by a doctor. Someone did ask about unicorn singlets. So what we've done, you might have, for those of you who've been around a little while, knew that we rebranded in March this year. We went from Unicorn Foundation to Neuroendocrine Cancer Australia. We had some stock, so actually the drawer with the singlets sits in my office, because this is where the volunteers normally come. So we've actually got some old Unicorn Foundation singlets that there's not all sizes left. I think there's only some limited sizes left, but we're selling them off at a discount on our website. So we decided to have a bit of a garage sale and to clear some of the Unicorn Foundation stock. So there's a few things in there. There's singlets, there's t-shirt, there's a few t-shirts. We've got tea towels. We've got a few things on there. I think with free gear, we probably would sort of want to say, maybe if you can raise a little bit of money, then maybe we can have a conversation about that. We probably can't give a free unicorn singlet to everyone who knits a row of their knitting, but if you're interested in doing there's something like a decent walk or a decent run, and turning it into a bit of a joining the team and turning it into a bit of a fundraiser, and you want to get out there and have some photos in a unicorn singlet, then we can definitely have a chat about that. I'd love to make that happen. So yeah, no, I'm sure we can do that. We've also got visors, so that's handy for sun protection in December too. So I think that's where I'm going to leave it. Gosh, I thought this was just going to be a really quick drop in. I thought maybe 15 minutes will do me tops. I'll talk about ascites. I'll give a bit of a plug to the events and things that are coming up. But then we had a few good questions. So this person's just saying investigations with a Holter monitor next week. So good. I'm glad that you have seen your doctor and that they're investigating that. A Holter monitor is, just for those of you who heard me say that and didn't know what it was, it's a way of doing like an ECG, so a heart rhythm test, where they stick the sticky dots on your chest, but they send you home with a little machine that's connected up to those leads, and you wear it in a little bag around your neck. Usually it's a 24-hour monitor, and it measures your heart rate over those 24 hours, and there's a button that they give you to press if you have an episode of dizziness or weakness or palpitations or whatever. So that's what a Holter monitor is. And then they take the probably it's a USB chip or something like that out of the machine, and they analyse that with their very smart computers and their smart brains, and they work out what's going on with your heart. So I'm really pleased to hear that you're having that investigated, and that's really good news. So yeah, well done for following that up. I'm glad. I'll sleep tonight now. So I'm going to sign off and leave you there. Tomorrow I'm not in the office because it's a public holiday, because Saturday it's the grand final for the AFL, which used to be, when I was growing up, it was the Victorian Football League, VFL, and it's not in Melbourne this year, it's up in Brisbane because we're the centre of contagion with this coronavirus. So I'm going to be watching the grand final on Saturday afternoon and pretending that I might be there. And just for anyone who might be following the footy, then go Cats. So anyway, that's enough from me. Someone's just said they can converse some people into maybe doing a 10K. So let's have a conversation about that. I'd love to have a few more people on my team, so I feel like I've got some friends. Anyway, I'm going. I'll see you all next week, and yeah, have a great weekend. And I'm back in the office on Monday. So take care.